Hi, this is Earl Hall from The Earl Hall Show, and you're listening to GrokTALK.
All aboard. This is GrokTALK, brought to you by the Coalition of New Hampshire Taxpayers and those of us who blog at GraniteGrok.com. We would like to welcome you to the last segment of this week's program. It is the day after Valentine's Day, so I hope everybody had a great Valentine's Day. We're hoping you're all happy, smiling, and full of chocolate and candy and going, oh, why did I eat all of that stuff?
You know, hearing that bumper music brings back memories.
Oh,
I played the guitar in high school, and I can play that lick quite well.
You can?
As Professor Reeder can as well.
Yes.
And I used to play that reader, and I used to play that rip, and it would be interrupted by my father thumping down the hall going, "Turn that down!"
Right. Well, we're about to roll in here. Let's get Skip on to introduce the doctor.
Yeah, and the crazy train. I gotta, next time we do that, just let me know. I'll turn it off so we don't have to listen to this. Very professional show. That's okay. Our current guest, Dr. Betsy McCoy, knows all about our professional show. Dr. McCoy, how are you doing today?
I am so glad to be on the phone with you as I'm barreling up Route 93, heading toward North Woodstock. And I'm going to be talking tonight about the importance of defeating Jean Shaheen and taking the U.S. Senate for the freedom-loving majority.
Wrong button. Ooh, easy there, dude. Absolutely right, because, you've been talking about health care. We have your latest book here, Beating Obamacare 2014. You've been on Fox News talking about this, and the things that have come out this week are just absolutely nuts. About the lawlessness that has arrived with Obamacare. And I'm just so grateful that you're willing to come around and talk to everybody. But you're right about Jean Shaheen. She took a marketplace that had over a dozen competitors, all offering different kinds of health insurance, and with her SB 11 bill, chopped it down to about 1.5, and then continued on at the national level to where here in New Hampshire we only have one health care provider. And Dr. Betsy, thanks for coming on with us.
Well, thank you. And the real issue here is the lawlessness that you underscored just a moment ago. I've got the Obama health law right here in front of me. But what the president is rolling out now bears very little resemblance to the law that Congress passed in 2010. He's mangled and distorted it. Literally over half the deadlines in the law have been ignored. The employer mandate has been delayed twice. He's granted a huge number of waivers, 1,472, just certain companies and unions. They don't have to obey the rest of the law the way most Americans do. And he even weaseled through that a special subsidy for members of Congress who were supposed to enroll in Obamacare. The thinking behind this is that if it's affordable for them, it's affordable for the rest of America. But even though they earn a base pay of $174,000, they got cold feet at the end and decided they weren't going to enroll in Obamacare unless we, the people, picked up the tab. So those are some of the examples of how the president has grossly violated the law over and over again. And that's what's really at stake here in November. It's not just slowing down Obamacare. It's holding the sword of impeachment over this president, this lawless president's head. And if we have a sufficient majority of freedom lovers in the Senate, people who revere the Constitution, they can take a nice walk down Pennsylvania Avenue and go visit the president and remind him what will happen if he doesn't obey the law.
Well, that would be wonderful, and it would also be wonderful. Okay, sorry. That'd be wonderful. It'd also be wonderful if just a few Democrats, realizing that this is unconstitutional, either to save their behinds or out of honesty, I don't put much store on the latter, joined in the move to impeach. But
Go on.
That
is so important because, in fact, it's very unlikely that the Republicans would win a two-thirds majority, which would be necessary to actually convict the president of high crimes and misdemeanors. But there must be some Democrats who agree with us that in this country the rule of law is king, not Mr. Obama.
And there's one more thing I want to just put in from this week's developments, which is if you own a company between 50 and 99 employees, you're subject to a special carve-out where you may get to extend the mandate a little further, but you're under all sorts of threats and penalties of perjury to swear that you didn't get under 99 by laying people off because of Obamacare.
Yes, I happen to be parked right across from the IRS as I'm chatting with you, and it's a reminder of how dangerous the Obama administration's plans for us are. They're nefarious plans because, number one, this employer mandate delay is not really a delay. Those employers who don't offer insurance can wait. They get a delay. But the vast majority of mid-sized employers who currently offer insurance under these regulations announced last week will have to continue to offer insurance, and they won't have the option of offering the more affordable plans they may have provided in the past, because I've spoken with many insurance companies this week, so they're not rewriting those plans anymore. So these employers are going to be forced to offer the more expensive one-size-fits-all Obamacare plans. There's no practical delay in the employer mandate. What you just described is hush money in return for signing that statement under oath with the penalty of perjury that they are not laying off people or reducing hours in response to Obamacare. They will be spared from a $3,000 penalty if one of their employees goes to the exchange for what they consider more affordable health care. But here's the rub. This is a way of silencing employers who have been so vocal in their concerns that Obamacare makes it impossible for them to run their businesses. And this is a way of silencing them until after the election.
Well, that was... Oh, sorry, Skip.
And this is one of the things that is so pernicious about what is going on. We talked earlier about in the show where different people are being forced to become government agents. For instance, if you go to see your doctor, you're going to get those Obamacare questions that you're supposed to answer. And my first comment is always going to be, so now you work for the government, and I expect to get the deer in the headlights response from that, because I don't want to answer those questions. Here with this mandate that you will not diss Obamacare, this is really beyond the pale. And you're right, you can't impeach him because the Democrats are never going to have less than a third of the senators. They're not going to we've gotten so highly hyper partisan that it's protect the party regardless of what's right for America. The question is who's going to have the standing to be able to stand up to run this through the court system, and who's going to have the money to actually try to run this through the court system to protect us from government?
Well, I do believe that in the end there will be some Democrats in the United States Senate who will watch as this president comes closer and closer to an all-out attack on our constitutional rights, and who will remember their own oath to support the Constitution, that we may, in fact, be able to get those votes. But the purpose of beating Jean Shaheen this year is to just have a majority in the Senate that moves us closer to being able to have that conversation with the president. And I have to tell you, some of the things that Senator Shaheen has done in the last week should cause anyone in New Hampshire, regardless of their partisan views, to worry. For example, she spoke out in support of the president's nefarious plan to increase the powers of the IRS to police political thought and political action.
And that's really interesting because we've seen in New Hampshire that the Democrats in the House have put through legislation which essentially nullifies the detention portions of the NDAA. In other words, on actual civil liberties, you can get Democrats to vote for something. And so if Jean Shaheen is perceived as taking away civil liberties, you can get Democrats maybe not to actually vote against her, but to stay home like conservatives did for bad Republican candidates.
Well, that's very important. And in addition, last week she also called the discussions of America's mounting debt, quote, a manufactured crisis. I would say she's one of the spendaholics in Washington responsible for that increasing debt.
Oh, it is a manufactured crisis, but it's manufactured by socialists of both parties.
Well, the fact is the debt is very real, and it will burden our children and grandchildren. Government is clearly becoming far too expensive. You know, when I looked at what's happened under the Obama regime, where federal spending has now reached 24% of GDP, and you add on the state and local, it's 42% of GDP. Imagine government spending sucking up 42% of everything all of us produce going to work every day. 42% of the fruits of our labor. Do you get 42% of your happiness from government?
No, I don't think that that's true. But you raised the other thing that we wanted to talk to you about, this recent OMB study where 2.3 full-time equivalents basically of jobs is just going to vanish. And now they're saying, well, now you have the freedom to choose not to work.
Job lock. They're freeing us from job lock.
Job lock, yeah, that's I mean, there is a sense of truth in that, because a lot of people stay at the jobs because of the health benefits. I mean, there's no doubt about that. Or one person, I saw that as a budget committee where moms would come in and work part-time for the school system, and their benefits far outstripped the amount of salaries that they were getting. And that way their husbands could go out and try entrepreneurial jobs. So there is a bit to that. But at the same time, to try to put the spin on to say, well, now because other people are going to pay the subsidies for you, you get to stay home and do nothing. You have the freedom to do nothing if you want. How fair is that to the rest of us?
It isn't fair. In fact, what it means is that the rest of us have to work harder and longer to pay for that freedom. And the fact is, I think it's wonderful when people feel free to make a decision to become a writer, a dancer, an early retiree, but not if it means the rest of us shoulder a bigger burden. We're all willing to help those who are disabled, who are unemployable, who are destitute for some reason, but not able-bodied people who want to put their feet up.
I think that we want to create a situation where we get rid of the job lock in Washington, D.C.
Amen. Term limits would do that.
We're going to take a quick 60-second break, and we will be right back, so stay with us. Hang on.
Steve McDonald here. You ever notice how Democrats like to create problems so they can then claim to solve them? Take Medicaid expansion, for example. Even if the federal government keeps its promise to New Hampshire to pay for most of it, it'll still cost New Hampshire taxpayers tens of millions of dollars more to provide inferior care and coverage to people who, for the most part, would never have needed it if Democrats hadn't reformed health care in the first place. That's right, that real expensive reform that doesn't care if it's only affordable if you act like you don't need insurance. Well, its number one claim to fame at this point is how many more people it forced onto Medicaid. And that's only because Obamacare kicks tens of millions of people off the plan they liked and were told they could keep but couldn't. So Medicaid expansion was always part of Obamacare for a reason. Democrats knew all along that the Affordable Care Act was unaffordable and they'd need to make Medicaid bigger and more expensive. So when people got their plan kicked to the health care curb, they could still sign up for something, even if it was something as crappy as Medicaid. This is Steve McDonald for GrokTALK, and we'll keep shining the light on them for you.
GrokTALk.
Okay, we're back. How'd you like that, Ed? We're having a lot of fun here. Okay, Dr. Cooper had a question for Dr. McCoy. I'm going to turn your microphone on.
This is Julianne Cooper from Liberty Harbor Academy, and I...
Oh, so nice to meet you.
Yes.
I've heard so many great things from JP
Yes.
about Liberty Academy. Yes.
Well,
very eager to see it.
Yes, and I guess we're going to get together at some point here. JP is going to do that. But I wanted to throw in something about this point about not working. Throughout history, our dignity, our sense of who we are as a human being comes through what we do, our work. And if we are creating an atmosphere where people are expected not to work, then we are literally taking another piece of the dignity away from our individuals. I mean, Common Core is doing it. The whole Obamacare thing is doing it. And now this idea that you shouldn't work or you don't need to work actually takes away identity and dignity from the people who are stuck in that place.
I so agree, and it wasn't a last-minute excuse devised by the Democrats to explain the loss of jobs. All along, Nancy Pelosi and others have been saying people shouldn't have to work to get health benefits. They should be able to get them whether they're employed or not. And the notion is that those who do work will have to work harder and pay higher taxes. Nobody's discussing exactly what it costs each time someone chooses not to work, goes to the Obamacare exchange, and signs up for subsidized health care. But it's costing $5,350 for each of those decisions, and for a family, about $20,000. $20,000 imposed on taxpayers.
Well, I have another question, because I want to say thank you for sending the latest version of your book, Beating Obamacare, version 2014. And I do want to swing over to that and change the topic for a second, because I do want to know what is different about this version versus your previous version, which I also read. And my other question associated with that is, because Obama is changing this so quickly, I hate to say it, but is this really out of date at this point, and will it get even worse next week?
That's a really good question. And you put your finger on the answer, which is that the health reform you see rolling out now bears almost no resemblance to the Affordable Care Act. And so I had to write a new book to update everyone on what's actually being done, but also to explain how to avoid some of the landmines until we can get rid of this law and replace it with something better that truly helps the uninsured. For example, if you're a baby boomer and you're in your late 50s or early 60s, you should line up your doctors now, your oncologist, your cardiologist, your internist, even if you're healthy, because if you wait till you turn 65 and go on Medicare, you won't find a doctor willing to take you on as a new patient. That's how little doctors are going to be paid under Medicare because of the cuts to Medicare under Obamacare.
Well, I've noticed that even my son's family all got respiratory problems and had to go to either the ER, and one of the littlest ones spent 3 days up in Dartmouth-Hitchcock, which is one of the great teaching hospitals here in New Hampshire, because she was really in a bad way. But my son tried to get in with my doctor and was turned away. And I will tell you what I think is very strange, and I've said this before. The last time I saw him, I said, well, what do you think of Obamacare from your position as a doctor? And he said, well, I think it's great that 50 million more people are going to now have access to health care. And I very wisely refused to mention that he had the sign in his receptionist window that said, we are no longer accepting Medicaid patients.
Right. Well, in fact, also, you may have noticed it when you went up to Dartmouth-Hitchcock. If not, you will certainly be noticing it soon if you go to a hospital. If you're planning on going to the hospital and you know it for a hip repair, a knee repair, something pre-scheduled, try to cobble together enough money for a private duty nurse, at least for the first night, because in response to the severe cuts in Medicare reimbursements to hospitals are already laying off nurses and spreading the care thinner. And that means when you push that button for pain relief or help, you're going to wait longer.
Wow. What other dangerous things to citizens? Because that's really what this is the danger of government trying to do one size fits all at a cut rate situation. What other things would we common folks normally run into that we're going to go, what the heck is going on here?
Well, you mentioned one before that I think is so important, and that's this. We all confide things to our doctor we wouldn't share with anybody else. And now doctors are going to be required, with real financial penalties in the future if they don't comply, required to enter your medical information in an interoperative electronic database that will be seen by thousands of eyes, not only other medical professionals, but other types of people as well. So if you're going to talk to your doctor about something truly personal, and most of us do, ask your doctor about keeping 2 sets of books. Your doctor will not be surprised, because doctors have taken a Hippocratic oath to keep their patients' medical information private.
I have been reading about a doctor in Arkansas who left the system to do cash for service because he didn't want to have to deal with all this. How much of this do you think we're going to see? We're going to see a lot of professionals leave this whole mess and just exchange cash for services?
I actually think
well,
so. I'm sorry.
Go ahead.
I actually think so, because we're seeing an increase in the number of walk-in clinics, pay for service, the simple stuff, the flu jabs and so on. Quick care is becoming cash for service. If you don't have insurance, you just go in and pay. And I just wanted to quickly mention the other side of the coin with the hospitals. As Obamacare bites, the state's reimbursements to hospitals for uninsured patients is simply going to vanish, and that's going to further squeeze those hospitals. Go.
Yes, in fact, Richard Foster, the chief actuary of Medicare, he's now retired, but he warned Congress twice during the hearings on the Affordable Care Act that these cuts to Medicare are so severe, about 15% of hospitals will go out of business. They'll be forced into the red, and other hospitals will definitely lower the standard of care, particularly the access to nursing care.
Yeah, and I noticed. Yeah, sorry. Go ahead.
Seniors bear the brunt. There's a provision in this law, 3000A, Section 3000A, that awards bonus points to the hospitals that spend the least per senior.
Yeah, that's going to extend their lives, and it's going to keep your other organization for hospital infection deaths extremely busy, I suspect.
Well, all of these cuts to hospitals reimbursements hurt my cause of preventing infections, but more than that, this is a very targeted reduction in available care for seniors, and you'll notice that hospitals will are likely to stop now recommending rehab or post-acute care, going to a rehab after you've had a hip replacement or a knee replacement, because that's actually counted against the hospital's record. They get whacked for that.
Yes.
So imagine trying to get a hip replacement and not go to rehab.
It's ridiculous. This is Dr. Cooper again, but my son-in-law is actually an anesthesiologist. And as Obamacare was being debated, he said he and a number of his colleagues were discussing a sort of the concierge, leaving the hospitals and doing concierge. And I think talking to him and his colleagues, we're going to see a lot of that, which is probably good because people will then know what things cost.
Yes. Unfortunately, it's not, even if you go to a concierge doctor, it doesn't help you avoid the lower standard of care when you finally get to the hospital.
Okay. A question along the same lines, though. Government tries to set one set of rules for everybody, and unfortunately they're not smart enough to understand how other people are going to find nooks and crannies to escape to get out from underneath this, like Dr. Cooper just brought up. My question to you is, have you been hearing anything about the idea that, well, if you want your license, you can keep your license to practice, but only if you give so much free care, or only if you do this, or only if you do that, and those are the things that government tells you to do. Are you hearing about anything about that, and any pushback from doctors that are going to say no more?
It hasn't happened yet, but Dr. Mark Siegel, who's a medical correspondent at Fox, suggested the other day that it may happen. And it would be very similar to what the IRS did last week when they told employers, well, you can avoid the penalty this year, but only if you sign an agreement that you're not going to tell anyone what the impact of Obamacare is on your business. Can you imagine Big Brother coming in and saying, well, you didn't have a legitimate reason to lower your labor costs. You didn't have a legitimate reason to move that person to part-time or move this person to another office. That's exactly what's happening in every aspect of the Obama administration, not just health care. I'm particularly concerned about health care because here they've actually put it into the statute. Take a look at Section 1311H1B, which for the first time in history, and I know Dr. Cooper, I'm sure, has looked at this, for the first time in history, it empowers the Secretary of Health and Human Services to dictate how doctors treat privately insured patients. So even if you've gone out and bought a plan from Cigna or Aetna and paid your own premium, no subsidy from the government, the government's still going to be calling some of the shots.
Right, because they want to standardize care for everybody, but that wasn't where I was going. Going off from what Skip just said, isn't it actually the case in California already that they are beginning to pressure doctors to see a sufficient number of Medicaid patients, and they're starting to look at doctors' hours and say, basically, you're not putting in enough work here, you need to take on more government patients?
That may be true, and as I said, Mark Siegel from Fox has already suggested that licensing may become an iffy thing. You may have to do certain things to keep your license. It hasn't happened yet, but it could.
So this is, do you see anything else coming that we should be aware of? We got about a minute.
Well, there are going to be many, many more changes ahead. I predict in the next 3 or 4 months, despite the Treasury's announcement last Monday, many, many employers are going to be dropping health care coverage and sending their workers and their families to the Obamacare exchanges because the one-size-fits-all plan they are now required to offer as employers just costs almost twice as much in some cases as what employers have offered in the past. And it's going to be a rude awakening for people who have always had on-the-job coverage to see what a raw deal it is to have to pay for it on the Obamacare exchange instead. Much higher costs, much higher deductibles, and much less access to the doctors and hospitals you want to use.
Yeah, I think, unfortunately, it really comes down to so many people having to suffer at the consequence of this law before they all stand up. But, I mean, by then it's probably going to be too late. So we want to thank you very much for coming on the show with us. It's a shame you couldn't be here. It's a shame you have to sit across from the IRS. But we're glad to have you on, and hopefully next time we'll get you in the studio.
Look forward to seeing you.
All right, Dr. McQuaid, thank you very much for being with us this afternoon, evening, day.
Show. It's a real public service.
Thank you so much. We'll have a good day. All right, that was the end of that. We're going to wrap it up here as people take off headsets and things get done. And, we're still working on some technical stuff. And we'll keep ironing these little bumps out in the road. But we want to thank you all for listening to GrokTALK today. I'm here with Skip Murphy. And we hope you have a great weekend. Enjoy the snow if you're in New England. And try to stay warm if you're someplace else.
Absolutely. Have a good week, folks.
Grok TV.